Media Watch, and this is another home edition show. As per normal, we have some wonderful guests with us. We've got Gurpreet, who's the president of the Gurdwara over in Shepherd's Bush, and also we are very honoured to have the president of the Sikh Doctors Association, hope I've got that right, in the UK, and that is Dr. Gagan. Lovely to meet you all. Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh.
Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh.
Let me first of all ask Dr. Gagan, can I ask you, you're the president, this association is quite famous in the UK. You do a lot of things for the doctors around the UK, and it has been challenging times. We've done some recent programs where we've actually last time around we had a doctor who was telling us about all the issues and criticality around not only well-being, but also why it's really it seems to be affecting, I think it was 66% of those from ethnic minorities seem to be more likely to be able to get COVID, unfortunately, coronavirus. But I wanted to kind of talk to you really, and I know you were going to come on last week, but let's talk about your society. When did it first start? What help does it give? And the reason I got Gurpreet here is because you've also helped the Gurdwara in Shepherd's Bush as well, and you're continuing to help as we hope that the Gurdwaras will open in a short period of time. So, Dr. Gagan, how are you?
I'm good, thank you. Thank you for inviting me to the show. So the British Sikh Doctors Organisation started in 2010, and it started because I, while working as a junior doctor, newly qualified doctor, I qualified in 2009, I noticed during my time as a junior doctor that there were a number of people from different ethnic minority groups who had a poor understanding of their health. And a lot of it was due to language barriers and cultural barriers. And I felt like there was a need for an organisation or group to try and work with people from those groups in order for them to understand their health and to arm them with the knowledge they needed to benefit from the excellent NHS that we have in this country. So I started British Sikh Doctors Organisation near the end of my first year as a doctor. And it was only me and a friend, and it spiraled into a big organisation with hundreds of members and many thousands of very dedicated Sangha members who follow us and support us when we do our screening programs throughout the country. The idea of the organisation was, number one, to go from community centres to religious centres, regardless of what religion or background people were from, to meet with people, to speak to them, see what they understood about their health conditions. We realized very quickly that, especially in some communities, without doing some kind of hands-on screening, people were not understanding our message, were not understanding what we were trying to tell them about their health. So we started doing screening programs, taking blood pressures, checking people's weights, and blood sugars and so on. And by doing screening, we were able to use it as a tool for education, and it works very, very well. And we have been screening for the last almost 10 years now. It's our 10-year anniversary in October this year. And that was one side of things. And then we very quickly went into the education and mentoring side of things. And we've been educating and mentoring a lot of medical students, dental students, ophthalmology, optometry students, pharmacists, and so on for the last 10 years. And mentoring young A-level, GCSE level students who would like to get into higher health education. It's fantastic. The British Sikh Doctors Organisation takes no money for it. We just need professionals. We absolutely love it. We enjoy it. And we have dedicated people from all backgrounds working with us. It's absolutely fantastic. And it's what keeps us going, the beauty of serving the Sangha and helping our fellow man, regardless of background.
Do you find that it's kind of a two-way street? Because I've designed a few mentoring systems in the past where they talk about a mentor and a mentee. And then they do say in management speak that the mentor gets something out. It's not hierarchical. It's more peer-to-peer. So people are able to understand what's actually happening out there or what's happening in their communities. And then you can come back as a mentor and actually change the way in which education programs work or outreach programs work. And we're going to talk about a specific case with Gurpreet about what you did in terms of understanding the requirements for from a Gurdwara perspective. You know, they needed a piece of equipment and you were quite advisory in that sense. But do you think the mentor-mentee relationship actually really does work in your organization?
Yeah, I mean, it's phenomenal. I mean, we're always learning. One thing about healthcare is it's estimated every 5 years that healthcare knowledge changes massively. Um, we, as well as supporting people, we learn a lot from them. A lot of our doctors and dentists have said to me many times that actually serving the Sanghas, doing the mentoring programs, doing these screening programs, they've learned a lot about how different people perceive health and understand health education. Absolutely. I mean, it's always a two-way street. You always learn and gain knowledge from the people you mentor, as well as them gaining something from you. And that's what makes it such a beautiful relationship and such an important relationship to have. Um, and it's the best thing about it is in 10 years that I've done it, I've gone from being a junior doctor to a consultant now. And in that time, there's a lot of the people we mentored have now entered, been through higher health education and now are doctors or dentists or pharmacists. It's absolutely phenomenal. It's amazing to bump into them in the hospitals or meetings, conferences, even around the world. And actually, it's quite emotional. It's lovely to see that they learn from you, and actually, often they're presenting things at these meetings, at conferences, and you're learning from them. It's phenomenal. It's fantastic.
Brilliant. Let's talk about that outreach program that you did. I'll bring Gurpreet in. Gurpreet, good to see you. Vaiki Khalsa, Vaiki Fateh. It was so wonderful. And I was talking to you earlier about this, and it's interesting that the Gurdwara had a particular requirement for some assistance. I'm not going to steal the thunder about what you guys did, but effectively you were in contact with Dr. Guggen, and you did consult both together on the best way forward with a defibrillator. Is that right?
That's right. So we felt we needed a defibrillator in the event that someone was having a heart attack or some condition where they would have needed to have use of a defibrillator to save their life. So it was great work with Guggen Singh because he was able to specify what the right one was, figure out where would be the best place to mount it, and also getting around to having people trained up on it. But we were very lucky as British Sikh Doctors organisation actually donated that equipment to the Gurdwara Sahib. So we're very fortunate and very honoured that British Sikh Doctors organisation did that seva for the Gurdwara Sahib.
And what's interesting is that moving forward, sadly, because of the environment that we're in right now, and we hope that things will get better as we move forward over time, and eventually there will be a vaccine. But for the moment, as the world is kind of loosening up the lockdown, there are obviously still dangers. I mean, I've got a particular question I'm going to ask both of you about. I mean, you're both very learned in terms of statistics, as well as, from your law background, Gurpreet, and Dr. Guggen in terms of statistics, because it seems to be led on statistics. A lot of the government policy seems to be going down that direction. You, as a doctor, are advising the Gurdwara in terms of, when it does open up again, how we can have safety amongst Sangat, where they sit in the Darbar hall, when they go down to have langar, the actual, it is limitations because not everyone can come. It's going to be difficult. But my question really is around, is statistics the only thing that tell us where we're going forward? I mean, we're relying on that. There must be purely other areas that we can use to gauge how much we lock down, because this big argument is that you can break this lockdown if there was more testing in place. But it's also about analysis as well, isn't it? Because it affects people in so many different ways.
Yeah, so I mean, the most important thing to understand about COVID is that there's still a lot of people out there that think it's just like the flu. It's not like the flu. I've been working the front line now for 8 weeks. My life has completely changed. And I've been seeing it firsthand. And I always say to people that only people working the front line really are seeing the health kind of implications of COVID. One day patients are well, and the next day they're nearly dying or have passed away. And the intensity of work that we've been doing for the last 8 weeks has been massively increased, and we're already a very busy and stretched service. When it comes to the Gurdwara, a little bit of history is that the Gurdwara is all Gurdwaras are obviously very important to all of us, but specifically Qasr Jatha is somewhere where I grew up. I grew up around people like Gurpreet Singh and other people, members of Sangit. And one of our first ever events as a British Trust organisation was at Qasr Jatha. And one thing that stands out about that event was, and Gurpreet may not remember this, but there was a person there that day that had a heart attack. And that same day, we met somebody who ended up actually being in an abnormal rhythm. Their heart was in abnormal rhythm. And if we had had the defibrillator there at the time, and the ambulance had not arrived in time, it did for both patients, for both people, I should say, those people could have passed away. And, thanks to the fantastic team that day and being in God's house, they both survived. So we were very passionate about getting defibrillator to every Gurdwara, and Qasr Jatha was in the first places because the now committee, the same members of the committee that are now there, were very forward with me and said to me, look, again, we need to do something. We need to think about getting defibrillator. They knew that we were running a project called Servo in Medicine in memory of one of our senior trustees and optometrists that sadly had passed away a year ago before we got the defibrillator. And we wanted to do something in her memory. And we got a fully automatic defibrillator for the Gurdwara. So it doesn't require training. And in fact, the machine basically tells you what to do if someone collapses. It will tell you when it needs to fire. And we thought it was the best thing for the Gurdwara. It's an expensive piece of kit, but I must say the Gurdwara were very good at accommodating it and finding the right place to keep it with me and the rest of the team, and just in safe hands. And we promised that if and when it's ever used, we will help to replenish the pads and the batteries when it's required. When it comes to COVID, I agree with you. Yeah, there's a high risk now that Gurdwaras are going to have people that come in and that could be very unwell without knowing they're unwell. And we now know that people with COVID can present with anything. We're not seeing people just present with a cough and a cold and a high temperature and also taste and smell, which was added to the list of the government signs that highlight that people made.
Isn't that right? Sadly, only recently added. It was overlooked. Other countries have.
Yeah. Well, actually, it's only confirmed today, actually. So, and actually, I think we, as physicians, as doctors, we know many people who had that sign and then were then diagnosed with COVID. But in older people, and a lot of our Sangat is older, and these are over 65-year-olds, we're seeing them present with other signs. We're seeing them present with collapses, with falls, with nausea, with vomiting, with diarrhea. There is no clear set of signs and symptoms for older patients. And we're seeing that in the hospital every day, and it makes things very difficult for Gurdwaras because they will only know what to follow as per government guidance, which is very, very important. So having a defibrillator available is important at this time for that, for that reason, because some people just won't know they have COVID because they will think they will either have no symptoms and they may have their first symptoms of Gurdwara. That may well be a collapse and a cardiac arrest. In terms of stats, before we get to the BAME issue, which I know we're going to talk about a bit more, the most important thing for the Sangat to understand at the moment, and the Gurdwara to understand, I know again, is we're involved in discussions through WhatsApp and face-to-face, well, not face-to-face, but socially distanced discussions between us in the past, that we need to keep what's called the R number down throughout the UK. So what that means is we need to make sure that we are not in a position that one person can infect many people. So we need to make sure that the Gurdwara runs its divans in a way that people are socially distanced, not mingling too much, shorten the divan so people are not being social after the dars, staying back and having a chat, meeting up. Unfortunately, traditional jar and milk that we used to enjoy after dars will have to stop temporarily. So all these things need to be reviewed. And the Gurdwara Sahib really took fantastic steps. And as soon as I spoke to Gurpreet and the team about stopping divans going virtual, these guys were amazing. They bought new equipment to make sure that they could see the divans. They turned their langar halls into community hubs and provided NHS staff and vulnerable people with food and drink. So they have taken the steps, and I'm confident that when Gurpreet and I get a chance to talk after this with the new government guidelines that have come out, we will be able to work out a good route to reopen the Gurdwara as a team. But the most important thing will be is knowing how much space we have in the Diwan Hall, knowing how we're going to keep people 2 meters away from each other. It may mean that we have to put signs down around, even on the actual chadra that people sit on. May need to think about that. And also thinking about how we're going to people into matate, because actually that's dangerous in itself, and how we're going to maintain hygiene around Maharaj, which is massively important. So these are all things to consider.
I never thought about that actually, about when you do matate as well. You know, it's a new one on me. I mean, just before you came on, we were talking. Gurpreet and I were talking about simulation, right? And I think you have, Gurpreet, if I could hand over to you for a second, you have consulted with Dr. Kogan and others, and you worked out a method. You've tried to simulate it. There's obviously a level of confidence. One of the things that we spoke about is we can't control kids. You know what they're like. They run around. Yeah. So it's going to be hard, isn't it?
Yeah, it's not going to be easy. You got to be very controlled. You got to do your risk assessments and consider these issues. So we've already measured up our Diwan Hall. We know how many people we can fit in, keeping them 2 meters apart. Again, around Mathatek, making sure we've got a plastic matting there, but with antibacterial wipes. So after someone has Mathatek, they can take a wipe that area, and they can then go dispose of that wipe and wash their hands again. So it's, again, keeping that sucham, keeping themselves clean, letting them know that if they're going to do a parikrama of the Maharaj, don't touch their palki. Just keep your hands to yourselves. Make sure people are wearing face masks. Make sure that I'm not 100% fan of gloves, because I would prefer people wash their hands more often and sometimes gloves gives a sense of false safety, and people won't be washing their hands. They've touched something and then straight to their eyes, and that's it. That's all it takes. The gloves can do that too. So we want people to keep themselves their hands clean. So we have a number of washing stations in the Gurdwara anyway, and they're all equipped with anti-bac soap and with paper towels, so you're not using normal towels and things. That we had anyway. But in addition, to reinforce that, along with the markings on the floor, keeping a control of footfall as to who's walking where and which way in, which one way out, and keeping sevadars there to control that and controlling the numbers that come in. We feel we can do it. To further arm ourselves, we're introducing a few anti-bac spray stations where you can just put your hands underneath, and it will, without touching, a spray will come out onto your hands, and you can give them a wipe and cleanse yourself of any bacteria. So we're putting measures in place. We will have to do lessons learned, see how did it go on the first day. Did we notice any risks? Was there anything that we were worried about? Because we got to keep Sevadars safe, we got to keep Sangat safe, and we got to keep the Granthis safe. So there's a lot of responsibility here. But on top of that, we want to make sure if and when we do open, it's not if, it's when we open, we do so in a safe manner, and that we can keep everyone safe. And that's where we rely on British Sikh Doctors Organisation, liaising with them, getting that advice, so we can do this in a safe manner.
I think what's interesting is, and I know recently, I think it was yesterday, you tweeted something, Gurpreet, about, and it is related, Dr. Kogan, because one of the things that the government's looking at the moment is the places of worship, and we really need to have proper Sikh representation there. I think, Dr. Kogan, some of the advice that you've given right now is actually also applicable to other places of worship. And it's another form of seva, if I could suggest that, would be, isn't it great that the thought that you have both put in to the Gurdwara, that would apply also to other places of worship as well? And whether or not they're doing it or not, or whether or not there should be some collaboration on that level, is really more of a question for you both. Gurpreet, a question for you, just to end the show with, about where is the representation from Sikhs, from Sikh Gurdwaras, And Dr. Gogan, do you not think that there should be a common task force that's been set up connected to the medical industry that is actually advising on best practice for different places of worship? Because there are commonalities and there are also differences as well between different churches and the way in which they worship God. I mean, I'll ask you first, Dr. Gogan, and if you could pass on to Gurpreet about the political side of things.
So, Gurpreet will talk more about this, but one thing Gurpreet and I always agree about, and we know this, I know this from social media recently, where we've been tweeting about these things, that there's so many groups, so many people are doing, and usually doing the same thing. We're all singing from the same sheet, if I can say that. We all want to do the same thing. We all want to help people. I think it's very, very important that there is a task force which involves Sikh leaders or recognized Sikh leaders who represent gurdwaras, because we're talking about gurdwaras here, and people who run churches should be representing themselves and so on. So people who represent the places that they're running should be involved in the task group. But I also think it's important to have people who have an idea of how the government works, how these senior level government bodies work, should be involved in this. And there should be a doctor who is from a doctor from each faith background should be involved in the discussions, because obviously they'll be able to support their faith leaders in understanding the medical side of things. Gurpreet, what do you think about that? I know you've been talking about it a lot.
Gurpreet, a few words, because we're going to close in a couple of.
That's sensible advice. So the issue we've run into is that the government did put a task force together, and there's all the faith groups except for Sikhs, the advisors are actual religious leaders, people involved in places of worship or connected to places of worship. But the Sikh representative was from a professional organization, a professional networking organization. And this has had Gurdwaras over the weekend up in arms saying, well, hang on, we know what's involved in Gurdwaras, we know what's involved in conducting Anand Karj, conducting funerals, conducting other programs and divans. Therefore, we need to be leading on this, because we feel that a professional organization won't be aware of the nuances. So there's been a lot of letters going out to the ministry today on that topic. So it does require a wider board, but my view is it should be the direct link needs to be someone who is connected to Gurdwaras, connected to the bricks and mortars of Gurdwaras. And all too often we find ourselves with organizations which don't have bricks and mortars, don't understand the responsibilities of building management, footfall and all of that, leading the way. And that's where things get missed and problems arise, and you end up having to go back and redraft guidance.
And one of the things that you have done, Gurpreet, is that you have gone one stage ahead and you've actually simulated what it's going to be like. So you've actually gone through the practice of it, and then you can report that back to the task force. I'm afraid I'm going to have to leave it there. I have to say thanks so much, Dr. Gogan. It's so nice to meet you, and Gurpreet, lovely to have you on again. We appreciate all your time. We wish you and your members, everyone in the medical industry, a safe situation, because it's still not safe. And we are really very thankful for all the hard work you do everywhere, not only on the front line, as well as looking after patients that are actually still needing support, because we can't forget the ones that still need their support. And Gurpreet, thanks for leading the way, and continue to network and do great things. We'll see you next time. Thanks so much. Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh.